urinary leakage, why it happens. When you take 1 in 3 women or 1 in 5 older men leak urine, they leak urine without meaning it because they don't really want to leak it, but it happens. Maybe while they are laughing or coughing or sneezing or rushing to the bathroom. It's really common, but it's rarely discussed. And today we are going to understand why it happens. It's a condition which actually takes away the dignity of the individual, poor hygiene, and social life. So what does it really mean medically? It's called urinary incontinence. That is the involuntary loss of urine. In simple words, passing urine without meaning to or without full control. But we should understand the urine system a little bit briefly. The kidneys filter blood and make urine, which travels down the bladder. You see, the bladder is like a balloon, a muscle that stretches to store urine. At the base of the bladder is a valve. It's called sphincter, and that controls the urine flow, the flow of urine outside the body. In men, the prostate wraps around it. The pelvic floor is very important to understand. It's a group of muscles stretched under the bladder, holding it like a sling. It gives extra support to the bladder. All these controlled by autonomic nervous system. What does it mean? Our body's automatic control system, specifically or medically, is called the parasympathetic nervous system. It means that we don't have control over it. It's the nerves which actually does all the job, which tells the bladder to squeeze and release the urine. Leakage happens when the valve or muscles or these nerve signals don't work properly. So how do we feel the urge to go to the bathroom? You see, as the bladder fills, it stretches. We have what they call stretch receptors. They are the nerve endings, special nerve endings in the bladder wall that will sense the stretching. It is very interesting that, you see, your bladder will not be 100% full. It starts to be just 30-50% full, and then it gives you an early alert so that you have time to find the bathroom before it's truly full. These signals travel up the spinal cord to parts of the brain called the pons. It's a small area at the base of your brain that manages bladder timing. So the pons, that's the part of your brain, decide when to hold urine and when to release it. But there's another reason why we also go to the bathroom. That is urine concentration. When your urine is very concentrated, it can also, its chemical stresses can also pick up this, and the same mechanism for you to feel like you have to go to the bathroom. There are 3 types of incontinence or this leakage. First is the stress incontinence. It's the leakage during pressure, like you are coughing or sneezing or you are laughing, or women during their pregnancy. Why does it happen? The valve at the base of the bladder becomes weak, or the pelvic floor gets weak in women during childbearing or pregnancy. And we have another incontinence or leakage called urge incontinence. Sometimes we call it overactive bladder. It's a sudden strong need to go to the bathroom, sometimes even before reaching that bathroom. Why does it happen? We have some special muscles. It's called distressor muscle that wrap around the bladder wall. It squeezes too early before even the bladder is actually full. It's controlled by the autonomic nervous system. This happens without our control. And we have the last type. It's called the overflow incontinence. This is a small leak without much warning. Why does it happen? The bladder doesn't empty fully. This can happen in 2 ways. A blockage like the enlarged prostate in men, or a weak distressor muscle, the muscle that wrap around the bladder is a bit weak. It can't push urine out properly. Now, let's see what causes in general, both men and women. In summary, it's a weak pelvic floor, okay, and weak valve that controls the urine flow outside the body. Overactive distractor muscle, the muscle that wrap around the bladder, it squeezes earlier before even the bladder is full. And we have blocked urine flow path, that is the urethra. And that is another problem because of, maybe in men, enlarged prostate or distractor muscles that wrap around the bladder. And we have nerve problems. The nerve problem normally is because of diabetes. People with diabetes will normally be depleted of vitamin B1. It's called benfotiamine. That the fast soluble B1 is very important. If you are deficient, your nerve system, autonomic nervous system, cannot work well, and so you may have issues with leakage. So anybody with diabetes has 3 times risk of getting this condition: urinary incontinence, stroke, Parkinson's disease, multiple sclerosis. That is a disease that affects the brain and the nerves. It can disrupt the signals that control the bladder. It's very important to look at insulin resistance because that's the base of type 2 diabetes. Extra pressure on the bladder because of obesity, you have too much weight, or chronic cough is also another factor. Constipation will put too much pressure on your bladder. Bladder cancer is rare. It's something that is not common, but it does happen. Now, with women, it's about pregnancy. Childbirth will stretch and weaken the pelvic floor. These are the group of muscles that support your bladder. It get weakened in women. And menopause lowers estrogen. When your estrogen level in women that lowers, it thins the tissue supporting the bladder, so you cannot push out the urine from your bladder well when you are passing urine. So you pass urine and you may feel that you still have something in the bladder. With men, it's about the enlarged prostate. It blocks the flow when the prostate is really enlarged. Or a man, if you have any prostate surgery or radiation therapy for prostate cancer or any kind of therapy around the prostate, it can also disturb the valve controlling urine release. So what is the solution? Strengthen the pelvic floor with Kegel exercise. Bladder training is also possible. Check your weight. Look at the cough. When you cough more than 2 weeks, you have to know something is wrong. Constipation is something that you have to take care of. And you have to look at insulin resistance, specifically maybe type 2 diabetes or pre-diabetes, because it deprives you of B1, which is very, very important. If you're suffering from urine leakage or any form of chronic disease, call this number. Share this number. Be a blessing to somebody. The number calling outside the UK is +44 738 464 7300. Go to my YouTube channel if you want to support this mission. Put in Dr. James Natural Link to support this